Well, hello again. Welcome to part 3 of our lecture series on vascular ring anatomy. In this video, we will be reviewing both the right arch with mirror image branching and the right arch with an aberrant left subclavian. This particular comparison demonstrates an example of how persistence of an embryonic arch can turn a normal variant into a complete vascular ring. So let's start with the normal variant, the right arch with mirror branching, and I'll explain how this forms from the embryonic model. Take a look at that here. So this variant is actually a non-pathologic normal variant that does not form a vascular ring. And frequently patients who have this are completely asymptomatic and go through their life without even knowing they have it. Um, the origin of this variant occurs when the left arch and the left sixth uh, aortic arch regress, leaving the right arch with completely mirrored branch vessels. So I'll go ahead and show that to you here. So this portion of the left arch and the left ductus regress. As you can see, that does not form a vascular ring, but instead completely mirror to the normal branch pattern. So as you can see, the left subclavian, the left carotid come off the brachycephalic, which is a complete mirror to how brachycephalic would normally be oriented. And so I'll go ahead and move then to the imaging data set. And as you can see, as we mentioned in previous videos, the uh, aortic sidedness is determined by the bronchus, which the aorta passes over. And so, as you can see here, the aorta passes over the right bronchus, thus defining it as a right-sided aorta. And so, other than that, the branch vessels are in a mirror pattern. And so, you can see here the first pink artery I'm pointing to right here is the brachiocephalic artery, which then divides into the left common carotid and the left subclavian. And then as I rotate further, you can see the right common carotid and the right subclavian here. And so as I kind of rotate further to the left here, you see two white cylinders we've inserted, which are possible insertion points of the ligamentum arteriosum. And as you can see, the subclavian itself is deflected here, and that is suggestive on the CT scan that that is where the ligamentum is inserting. But because the ligamentum does not have any blood flow, it doesn't show up on the CT scan, and so as easily. So as I kind of rotate back and look from above, you can see that this does not in any way form a ring around the trachea or the esophagus. And so even though we had to, as you can see, draw in some of the esophagus here, that's just because it was collapsed abnormally with not due to compression by a vascular ring. And with that, I'll go ahead and move to the next example here, which is the right arch with an aberrant left subclavian. And so in a slight variation to the previous example we just discussed, this lesion actually originates from persistence of the right fourth branchial arch and the left sixth arch. So again, it's actually persistence of that left sixth arch, the left ductus arteriosus, that completes the vascular ring. And I'll go ahead and show that to you here. So when this segment progresses, um, and then actually the right ductus regresses, you then are left with a right arch with a left ductus arteriosus, and that actually does form a complete ring, as you can see from this angle, around the trachea and the esophagus. I'll go ahead and rotate that back here for you. And so in this example, it's actually associated with an aberrant left subclavian, which is a little bit easier to explain here on the imaging data set. But the aberrant left subclavian arises from a retroesophageal diverticulum called comrol's diverticulum. And I'll show it to you here. It's marked in white. You can see this diverticulum. And whereas normally the left subclavian would take off here, instead it takes off more distal on the aorta than all the other vessels. So you can see both of the carotid arteries are coming off from a a common trunk. And then we have our uh, right subclavian here, and then rotating even further, you have then the left subclavian coming off from this diverticulum called Commerle's diverticulum. Um, and this diverticulum is actually named after the first doctor to clinically diagnose a vascular ring in 1936. The diverticulum is present in about 60% of cases of this aberrant left subclavian with the right arch. Um, and interestingly, only about 10% of these cases have associated intracardiac defects, so frequently can be the only lesion that you see in these patients. And so how do these patients present? Well, they typically will have mild respiratory difficulties in late infancy or swallowing dysfunction. And as I mentioned before, the double arch is the most common symptomatic vascular ring. But understandably, this is actually the second most common symptomatic vascular ring. And so although it's not quite as severe as the double arch, it will still present early, just not usually in early infancy, rather in late infancy. And so, how do you treat this? Well, you typically involves surgical division of the left ligamentum arteriosum right here, so just dividing that. And then there's also suggestion that in the case that there is this associated aberrant left subclavian here, that you should reimplant the left subclavian and resect this diverticulum, and thus and while you're doing that, reimplant the left subclavian on the left carotid artery, and that creates essentially a mirror branch pattern similar to the previous example we just discussed. So you would take the left subclavian here and insert it here. And so with that, we'll go ahead and pause our discussion here. In the next video, we'll be discussing two incomplete vascular rings, the left aortic arch with an aberrant right subclavian, which is the exact opposite of what we're discussing here. And also we'll discuss the anomalous left pulmonary artery, which is commonly referred to as the so-called vascular sling. So thanks again for watching. We hope that you continue to enjoy these videos. Appreciate it.